COVID-19 has presented important communication lessons for governments globally. With elections looming, will coronavirus safety regulation messaging be adjusted? Well, to discuss this further, we're joined by GCIS Chief Director of Policy and Research, Tasneem Carrim, and University of KwaZulu-Natal Acting Deputy Vice-Chancellor for Research and Innovation, Professor Mosa Moshabela. Good evening to both of you, and thank you so much for being available for this conversation. You know, Tasneem, let me begin with you. When we look at just the generic reviews of communication during this period, there is a lingering critique about the fact that, by and large, government has been found on the back end of the communication. So having to deal and communicate where there's misinformation, where there's fake news, and that there hasn't been really a good job of owning the narrative and leading the conversation with facts and credible information. I'm curious to know just your own reflections on this and just, you know, how you're navigating this space.
Thanks, Kathy, and good evening to all. It may surprise you to know that sometimes we are our own worst critics. So, of course, we always feel like we could be doing better. And we do continuously look at how we're doing things and what we're doing and how we can improve so that we can communicate better with our people. We do take the view that ours is a developmental state and a democracy. And so we do approach communications from that point of view. We also have a very diverse society. So we use multiple platforms to communicate to various parts of the population. And some are more successful than others. We are the first to admit that. Having said that, and I'm acknowledging that we could always have done better and we can always still do better. But having said that, we did win a prize for managing the infodemic by the World Health Organization. So that gives you a sense that we're not alone. Many countries are facing this kind of challenge. And in particular, because the nature of the virus, there's so many unknowns about it. And so many things we may have communicated in the beginning are no longer true, or new things come to surface. So it is a continuous process, and that's exactly why we are doing the kind of research that we do. The first time that we've decided to host a webinar to talk about it, but we have been doing this kind of research since the beginning of the campaign and ongoing since 2002. Thanks.
And what was the prize for?
So it was South Africa's ability to manage infodemics. And that is, you know, it relates to how we manage health information and how we manage misinformation or disinformation. So the Department of Health and the South African government was awarded this by the World Health Organization in 2020.
All right. And so congratulations then on that award. Professor Moshabela, let me bring you in here because in spite of the fact that the country may have been recognized for the work that it's doing, the situation we're in today, where we're seeing these high levels of vaccine hesitancy and, you know, that's stemming from the misinformation out there, also in and of itself tells its own story.
Yes, greetings, Kathy, Tasneem, and viewers. Absolutely. I think that most of us acknowledge that public health communication turned out to be one of the most important components of the response to COVID-19 as a whole, but especially also now in terms of vaccines. And when one reflects on this, you know, at the beginning, I think that it was right for government to initially centralize communication, where the president and the Minister of Health were really the ones communicating. But I think from then on, we failed to adapt because then what we needed to do in order to prevent the kind of scourge of misinformation was to have a lot more voices, more diverse voices, speaking, singing from the same hymn book, speaking in the same voice. And we were not able to adapt in that sense. And then what happened is that the wheels came off, and you could hear even the sort of other political heads speaking in different voices, in different sectors, people were speaking in different voices, even scientists were speaking in different voices. And all of those things led to a lot of confusion in the general public. And also because of the rapid explosion of new knowledge and new information that, government did not really have time to synthesize before it is given to the population. It meant that that information spilled into the general public very quickly through the media, mainstream media. And that meant that people were engaging with the kind of information and the format of information that they would normally not engage with. And it really created a lot of problems. In a way, there were positives there, because I also saw a level of engagement with science by the general public that I had not seen before. Even with HIV, we did not see that level of engagement with science. But the consequence really has been that people were processing information that needed to have been digested for them first, synthesized for them first, before it's presented to them. And unfortunately, raw information can be very difficult for the general public to digest.
So Tasneem, in terms of the work that you're doing and the research in GCIS to also not just reflect, but to see where the gaps are, what are some of those that have been identified? I think it's important that you share that with us so that we know what the strategy is going to be going forward, given the fact that we're entering this period where undoubtedly, the politics is going to overtake the conversation around COVID-19, at least until after the elections.
Absolutely, Kathy. I think, Prof Moshabela's comments are absolutely spot on. And in fact, it may not be well known, but, in a previous iteration of the same research that we've done, where we measured awareness of COVID and awareness of the message from government on COVID, where we found that actually message recall was quite high. One of the things that we found was that urban areas and people in the higher segments of our segmentation model, those who have access to social media and those who receive information quickly and who use multiple forms of media, they had a higher awareness. And we then adapted the communication plan, so that we shifted communication tools towards rural areas. So we've seen that picture change over time. And in this current round, what we found is that this time we have been asking about awareness of government's vaccine program. And what we have found is that there's a similarity in awareness levels in the rural areas and in the urban areas. We also found previously that certain platforms were more favored than others. Now, any communication professional will tell you that you need to use an integrated communication mix. So you need to use many platforms to get your message across. And we do that. But you also need to measure which ones are most effective. And then you need to shift resources towards those. So that's how we did adapt. In this particular one, I want to come back to this issue about that you mentioned right in the beginning about vaccine hesitancy. And I think, we talk a lot about it in government, inside of government, with the media, and amongst academics. But many of the studies have shown that we don't have the kind of hesitancy in this country that other countries have. We have, in our study, we've shown that 62% of the population are willing to be vaccinated. That's very close to achieving herd immunity if you assume that all the 62% take the vaccine. And in other studies, such as the UJ and HSRC one, they've even got a higher willingness, at 72%, So we do think that there are other reasons why people are not vaccinating as fast as we would like them to. There are some educated guesses why this is the case, but we are exploring that going forward. And we certainly, we think we'll come back with a more definitive answer. And I also think that one of the things that we found was that there's a higher reluctance amongst the youth. And when I say higher, I don't mean over 50%. It's 36% of the youth group between 18 and 24 years of age were unwilling to take the vaccine. So the 36% is not really a high proportion of the population. If you compare it to France, the same age group is at 50% of that population group. So that means we need to direct our campaign a little bit more towards the youth. And with the little resources that GCIS is sitting with, but together with our partners,
sure.
We are pursuing a more youth-based program. And if I may, Kathy, I just want to come back to also another point.
Please,
that
very
Prof
briefly
raised.
for me.
Sure. You know, I think he's absolutely right that we may have not adapted fast enough, but certainly we did try to expand the partnership. So we now have a partnership with business, labor, and civil society, in which the messaging gets promoted through all of those platforms. So you'll see that business, labor, and civil society on the vaccine rollout program are more or less speaking from the same hymn sheet now.
All right.
Thank you.
Professor Moshabela, quickly running out of time. So your own reflections then on how we sustain the momentum around vaccinations, around the awareness of COVID-19 in the midst of this election cycle.
Yeah, I think that, Kathy, one of the things that came out of this study by GCIS and Ask Africa and Solidarity Fund is that people trust more the doctors and nurses in terms of sources of information. And one of the gaps that we've seen is that doctors and nurses and healthcare workers in general have not had a mechanism to ensure that they can be the first ones to receive breakthrough science in a way that makes sense, that they can communicate it to patients. I think that needs to get priority. If they are now the sources or the trusted sources of information, we've got to make sure that they are empowered with the tools that they need. And this makes sense because previously people kind of had more myths because of perceptions, but now people are getting vaccines and they are talking to healthcare workers, and that's where they get their information. So I think that South Africa needs to make sure that all our healthcare workers are empowered to be able to engage patients confidently with the right information.
Let me thank you both for your time tonight, Professor Mosa Moshabela and Tasneem Carrim from GCIS.